Welcome back. We are at Chapter 2 and we are going to be talking about the well-being of the EMT. Topics that we're going to discuss are going to be the well-being, personal protection, diseases of concern, emotion and stress, and scene safety. In this section, we're going to talk about the well-being of the EMT. Importance of well-being. Prevention is a hot topic. Our physicians stress this when we see them. Eat right, lose weight, exercise, so on, so on, so on. And this advice and in this chapter are designed to promote your overall well-being. So this section begins with the well-being chapter with some important concepts designed to help you obtain and maintain a state of well-being. If you are faced with a dangerous situation, would you respond better if you were in good physical shape? And if you were faced with challenging situations, in which hand to drag or carry a patient several hundred feet to safety, would you be better where you are or if you were in better shape? If you were faced with a call that hit you hard emotionally, would you get through it better if you were in better physical and mental place than what you are right now? So to answer these questions and to answer all of these questions is yes. And the concept of well-being aren't difficult if you start to maintain some healthy habits. So keeping yourself prepared for demands and risks of the EMT is very important. And if you are unable to function for any reason, the patients may not get the needed care that they deserve. So to maintain your well-being, you want to maintain solid personal relationships. If you have a difficult call, you will do better if you have that support system. It might be family, friends, EMS colleagues, anybody who is there for you and in difficult times is vital to your well-being. Next is exercise. An exercise program helps you in many ways, and a well-designed program helps you build strength and improve flexibility, and also promotes that cardiovascular fitness. Sleep is also very important. Rest is extremely important. Lack of sleep can be a significant factor in medical errors and improper decision making. Fatigue might also increase the potential for motor vehicle collisions, harms personal relationships, and actually can lead to a frequent illness by decreasing the immune system functions. So sleep is very, very important. Next is eating right. Eating provides fuel for the body, especially during long EMS shifts and with strenuous activity. Eating the right foods rather than wolfing down junk foods is critical. We always called it the gas station gut bombs because it's 2 o'clock in the morning. There's the only thing that's open is the gas station, and you go in there to those nasty little sandwiches that are sitting in the box wrapped in plastic, and you open it up, throw it in the microwave for 30 seconds or a minute, and you eat it. Those are not healthy for you. Those hot dogs that have been rolling on the hot dog roller from 7 o'clock that night and it's now 1 o'clock in the morning, those are not good for you. That is not a good, healthy diet. Next is seeing your physician regularly and keeping the up to date on your vaccines. So bringing this well-being section is a full circle, basically, is what you can say. But regular checkups help ensure that we are well and that we can help prevent or catch any serious injuries before they arise. And another one that I actually forgot about is limiting the alcohol and caffeine intake. And I know working in EMS, that is what you live on is caffeine, to stay awake at those 10 o'clock p.m. transfers to Fargo or Minneapolis or wherever you have to go and whatnot. And the first thing you want to do is you want to go to grab some caffeine. And with the alcohol, although alcohol may be enjoyable in mood altering or moderation and what sort, excess intake reduces your performance and brings on personal, medical, and social issues. And caffeine may seem like a pick-me-up at the moment, but as the saying goes, what goes up must come down, and your body will only take so much of that artificial stimulation before it'll eventually crash, and then you're done for the night or the day. So plus, even though you feel more awake with caffeine in your system, your decision making and reaction time can still be very impaired. So just keep those all in mind when you're doing the well-being side of things and don't get caught up like so many EMS personnel do. In this next section, we're going to talk about personal protection and standard precautions. Okay, standard precautions. So diseases are caused by pathogens and then organisms such as viruses and bacteria that cause infection. So pathogens may spread through the air or by contact with blood or other body fluids. So bloodborne pathogens can be contracted by the exposure to the patient's blood and sometimes other body fluids, especially when they come in contact with an open wound or sore on the EMT's hands, face, and other exposed body parts, including that mucous membrane of the nose, mouth, or eyes. So even minor breaks in the skin, such as those found around the fingernails, can provide a pathway for those pathogens to enter into your body. Airborne pathogens, on the other hand, are spread by tiny droplets sprayed during breathing, coughing, or sneezing. And these particles can be absorbed through your eyes or when you inhale. So since it's impossible for the EMT or other healthcare professionals to identify patients who carry these infectious diseases by just looking at them, all body fluids must be considered infectious, and the appropriate precautions should be taken for all patients at all times. So when thinking about it, you got to take your equipment and your procedures that protect you from blood and body fluids of the patient and protect the patient from your blood and body fluids as well. And these are what are considered those standard precautions. So for each situation you encounter, it is important that you apply appropriate precautions, and taking too few will clearly increase your risk of exposure to a disease. And too many can potentially alienate the patient and reduce your effectiveness. So you have to have that perfect little situation, I guess. Occupational Safety and Health Administration, also known as OSHA, has issued strict guidelines about precautions against exposure to bloodborne pathogens. Under the OSHA guidelines, employers and employees shall share responsibility for these precautions. Employers must develop a written exposure control plan and must provide emergency care providers with training, immunizations, and proper personal protective equipment or PPE to prevent transmission of the disease. The employer's responsibility is to participate in the training and to follow the exposure control plan. There are also a requirement for all agencies to have a written policy in place in the event of an exposure to an infectious substance. Any contact, such as a needle stick or contact with potentially infectious fluids, must be documented. You need to refer to your local policy for reporting an exposure incident. Most plans call for baseline testing of the exposed person immediately following the exposure and periodic follow-up testing. In addition, federal legislation has made it possible for the emergency care providers to be notified if the patient whom they had potential infectious contact turns out to be infected with a disease or virus such as tuberculosis, hepatitis B, or HIV. Although deciding on taking standard precautions may seem intimidating, especially if you are just beginning your training, remember that by following the proper precautions, it is possible to have a long and safe career in EMS free from any infection or diseases. Always remember to wear your personal protective equipment to prevent exposure to contagious diseases. Next, we're going to talk about personal protective gloves. So vinyl or other non-latex gloves should be used whenever there is a potential for contact with blood or any body fluids. This includes actions such as controlling bleeding, suctioning, artificial ventilation, and CPR. Make sure that you have the gloves on or available for you to come in contact with the patient. Otherwise, you might get distracted and forget the gloves and may accidentally become contaminated. Be sure to change your gloves between patients. In many years, using latex in healthcare in both hospital and pre-hospital environments, many patients and providers developed allergies to the latex. The gloves that you will see in the ambulance are now latex-free, as are oxygen delivery devices and any other supplies. When taking gloves off, you want to pull at the top glove number 1 and pull glove number 1 inside out. Next, we're going to talk about hand cleaning. So even though you wear gloves when assessing and caring for patients, you must still wash your hands after patient contacts, even when gloves are removed. There are 2 methods of hand cleaning. The first one is the most recommended, which is hand washing with soap and water. So you're going to vigorously hand wash and then wash your hands after each patient contact whenever they become visibly soiled, even if you're wearing gloves. The next one is the alcohol-based hand cleaners, and these cleaners are considered effective by the Center for Disease Control, or also known as the CDC, except when hands are visibly soiled or when anthrax is present. And they're often available when soap and water are not. So in the back of a truck, if you get your hands soiled and you don't have water and soap available, that is when you're going to take that alcohol-based hand cleaner and use that. Again, though, once you get back to an area where you do have good water and soap, you want to be sure that you're washing your hands with that as well, even though you did use that alcohol-based. And if you really look in the sink after a hand wash like that, you can see that the water is actually dirty even after, at the time that you've used the alcohol-based hand cleaner, it is actually dirty when you wash them too. When doing hand washing, you want to be careful and methodical. Hand washing is very effective in reducing that exposure to any contagious diseases. So it's very important that you wash them good. And if the only thing that you have is the alcohol-based hand cleaners, they are effective and often available when soap is not. Next, we're going to talk about face and eye protection. So the mucous membranes surround the eyes are capable of absorbing fluids. So you want to wear eye protection to prevent splashing, spattering, or spraying fluids from entering the body through these membranes. So that's where protective eyewear should provide a guard from the front and the sides. There's various types of eyewear on the market. So if you do wear prescription eyeglasses, clip-ons, there are clip-on side protectors that are available. So some companies offer protective eyewear that resembles eyeglasses, but you should have, the guards on the front and the sides. So with masks, in cases where there will be blood or fluid spatter, you want to wear a surgical type mask. In cases where there's tuberculosis suspected, that's when you want to wear the N95 or the HEPA respirator, which is approved by the National Institute for Occupation Safety and Health. And then face shields offer a protection of the entire face as well. And there's times when people will wear masks, but they will also wear face shields on top of that. Again, you want to wear that NIOSH approved respirator when you suspect that a patient may have tuberculosis, because that is an airborne disease. You can wear a protective mask and face shield when suctioning a patient. There is some spatter that does happen, and so it's always good to wear a mask and a face shield. Gowns and aprons are also worn to protect clothing and bare skin from spilled or splashed fluids. Arterial bleeding, which is a spurting bleeding, is an indication for a gown. Another one would be childbirth, and patients with multiple injuries also often produce considerable amounts of blood. So any situations that would call for the use of a gown would also require gloves, eye protection, and a mask. It's a good idea not to only use personal protective equipment yourself, but to also be an advocate for its use. So you want to encourage your members and your crews and others to use the appropriate protective equipment, not just yourself. In addition to the moral and ethical obligation to do so, you will be helping others and keep your crew in good health. So always properly remove and discard any protective garments that you may use and carry out the disinfection and cleaning operations for each one. And then of course you want to complete all reporting documentations regarding the infection control. In this section, we're going to talk about the disease of concern. So infections that can cause inflammation of the liver are hepatitis B and C. It can live on the surface in dried blood for several days, and it can be deadly. It kills hundreds of healthcare workers each year before the vaccination was actually available. Hepatitis C, though, has no vaccine and poses the same risk. So it's very important that we talk about communicable diseases, and it is a strain on our public health system and EMS as a whole. TB, or tuberculosis, is an infection that sometimes settles in the lungs and that in some cases can be actually fatal. It was once thought to be largely eradicated, but in the late 1980s it made a comeback. TB is highly contagious. Unlike many others infectious diseases, it can spread through the air. Healthcare workers and others become infected even without direct contact with the carrier. And because it is impossible for the EMT to determine why a patient has a productive cough, it is safest to assume that it could be a result of TB and take the necessary respiratory precautions, not only for you, but on the patient as well. This is especially true in institutions like nursing homes, correctional facilities, homeless shelters, or where there is an increased risk of TB. AIDS, which is an acquired immune deficiency syndrome, is a set of conditions that result when the immune system has been attacked by HIV, which is the human immunodeficiency virus, and it becomes unable to combat the certain infections adequately. Although advances are being made in treatments of HIV and AIDS, no cure has been discovered at the time of this publication or this text. HIV and AIDS presents far less risk to healthcare workers than hepatitis and TB because the virus does not survive well outside of the human body. This limits the routes of exposure to direct contact with blood by the way of open wounds, intravenous drug use, unprotected sex, blood transfusions, and puncture wounds in which HIV is introduced, such as an accidental needle stick. However, less than half of 1% of such incidents result in infection, and according to the US OSHA, compared with 30% for the hepatitis B virus. So the difference is due to the quantity and strength of the HBV compared with those of HIV. Hepatitis B, C, TB, and HIV and AIDS are the communicable diseases of the greatest concern because they are potentially life-threatening. However, there are many communicable diseases to which emergency response and other healthcare personnel may be exposed. AIDS is considered the low risk for healthcare workers, lower than hepatitis or TB. Contact with the blood is the usual route for infection. When you talk about Ebola, people in the US was infected in 2014. It had the hemorrhagic fever and high rate of death and lack of definitive treatment. People get respiratory infections quite commonly. In most cases, these are mild, causing runny nose, sore throat, and fever, and are limited to just a few days. However, there are more severe respiratory illnesses that have been found around the world. You may have heard of two of them in the news, which is the first one is the MERS, or the Middle Eastern Respiratory Syndrome, which is one of the most recent ones. It has been found primarily on the Arabian Peninsula, although cases have been found in more than a dozen other countries and regions. So the other one is SARS, which is a severe acute respiratory syndrome, which is caused worldwide and when emerged in 2003. It affected more than 8,000 people around the world and caused almost 800 deaths. It was a widespread throughout respiratory droplets by coughing, sneezing, or touching something that was contaminated and then touching their nose or their eyes. Protection against MERS and other respiratory infections in a patient's care setting includes frequent hand washings and the use of gloves, gowns, eye protection, and an N95 respirator. Avian flu is a disease found in poultry that can also affect humans. Outbreaks have been seen in Asia, in the Near East, and Africa, and have been fatal in about half of the reported cases. The virus has not shown to be easily transmittable from human to human. Symptoms include traditional flu-like symptoms that progress more to severe conditions as pneumonia and acute respiratory distress syndrome. Precautions are the same as for SARS. Influenza has been around for hundreds of years, and the influenza pandemic of 1918 killed between 30 million and 50 million people around the world. There are many strains of the flu, including each year's seasonal flu. The avian and the swine flu viruses have caused widespread illnesses and some panic. EMS can help prevent the spread of the flu by recognizing flu symptoms and placing a mask on any potential flu patient before entering the hospital. When we talk about infection control and the law, scientists have actually identified the main culprits of the transmission of many deadly infectious diseases, which is the blood and the body fluids. EMTs and other health workers have been recognized as having a higher than usual exposure and therefore a higher risk of contracting these unwanted infections. Congress and federal agencies have responded by taking several steps to ensure that the safety of people who are at high-risk positions have the means to be covered. In particular, OSHA and the CDC have issued standards and guidelines for the protection of workers whose jobs may expose them from infectious disease. OSHA standard on bloodborne pathogen requires infection control to be on the joint responsibility of employer and employee. EMS agencies provide training, protective equipment, and vaccinations to their employees. And then employees participate in an infection exposure control plan. This list is the critical elements of the standards that are summarized. So this you're going to find on chapter 2 in page 34 and 35. So I recommend you reading through these. And they are the infectious exposure control plan, the adequate education and training that each EMT needs, the hepatitis B vaccination, personal protective equipment, methods of control, housekeeping, labeling, and post-exposure evaluation, and then the follow-up. The Ryan-White CARE Act allows EMS providers to find out if they have been exposed to potentially life-threatening diseases while providing patient care. They have a designated officer that gathers facts and potential exposures. This is another one that you need to know about, understand it, and know what it does, because this will be on your tests. The designated officer is responsible for gathering facts surrounding possible emergency responder airborne or bloodborne infectious disease exposures. You want to take the time to learn who is the designated officer within your organization. Two different notification systems for infectious disease exposure are defined in the Act. The airborne disease exposure, which you will be notified by your designated officer when you have been exposed to an airborne disease. Bloodborne or other infectious disease exposures, you may submit a request for a determination as to whether you were exposed to a bloodborne or an other infectious disease. Once notified of an exposure, the employer will refer you to the healthcare professional for evaluation and follow-up. The tuberculosis compliance mandate. OSHA's respiratory standards will have a selection and use of respirators. You want to wear a NIOSH approved N95 or HEPA mask when you are caring for a patient suspected of TB, transporting an individual from such a setting in a closed vehicle, and performing any high-risk procedures such as an endotracheal suctioning and intubation. Immunizations. Immunizations for hepatitis B, other infectious diseases, should be available through the EMS agency. Regular TB testing may also be required. And local system protocols vary, so know your local system and know your protocols on what immunizations they require. In this section, we're going to talk about emotion and stress. Physiologic aspects of stress. Stress is inevitable in the EMS profession. You need to recognize the signs of stress and developing strategies to deal with stress that are very important to the EMS career. Resilience means toughness or an ability to overcome tough situations. Helps EMS providers deal with difficult situations. It includes understanding stress and being physically and mentally able to respond, and using techniques to mentally process the difficult scenes that you may come across. During your stages of the aspects of stress, your first stage is going to be your alarm reaction or your fight or flight. Your second stage is going to be the stage of resistance or coping with it. And your third stage is exhaustion or the loss of ability to resist or adapt to the stressor. Types of stress reactions. There are 3 types of stress reactions that are commonly encountered: acute stress reactions, delayed stress reactions, and cumulative stress reactions. Any of these may occur as a result of a critical incident, which is a situation that triggers a strong emotional response. An acute stress reaction occurs simultaneously with or shortly after a critical incident. A delayed stress reaction, also known as a post-traumatic stress disorder, may occur at any time, days, and even years following a critical incident. And then the cumulative stress reaction is also known as burnout, and it occurs as a result of the prolonged reoccurring stressors in work or private lives. Any of these situations that triggers a strong emotional response needs to be taken care of. Go and get help, talk to somebody. There's EAP programs available, and there's critical incident stress debrief teams out there that after a critical incident, you can contact them and they will take you through the steps of everything that you just got done experiencing. Acute stress reactions are often linked to catastrophic, such as a large-scale natural disaster, plane crash, or a co-worker's line of duty death or injury. Signs and symptoms of an acute stress reaction will develop simultaneously or within a few short time following the incident. They may involve one or a combination of the following areas of function: your physical, cognitive, emotional, or behavioral. These are signs that the particular situation is overwhelming and your usual abilities to cope and perform effectively are skewed. It is important to keep in mind that they are ordinary reactions to extraordinary situations. They reflect the process of adapting to challenge, to change, and things that you're not supposed to see. They are normal and are not a sign of weakness or mental illness. They may require professional intervention. Like an acute stress reaction, a delayed stress reaction, also known as post-traumatic stress disorder or PTSD, can be triggered by a specific incident. However, the signs and symptoms may not become evident until days, months, or even years later. This delay in presentation may make it harder to deal with the stress reaction, since the individual has seemingly moved past the incident and moved on with life. Signs and symptoms may include flashbacks, nightmares, feelings of detachment, irritability, sleep difficulties, self-harm, behaviors or habits, or problems with concentration or interpersonal relationships occurring for a month or longer. PTSD is not new. The syndrome was first identified in soldiers and called battle fatigue or shell shock. Many combat veterans experience PTSD. It may also be seen in victims of natural disasters or those who have been violently assaulted or abused, and those who have witnessed unusual violent events. It is uncommon for persons suffering from PTSD to seek solace through drug and alcohol abuse. But because the delay of the apparent disconnect between the triggering events and the response, the patient with PTSD may not understand what is causing the problem. PTSD requires an intervention by a mental health professional. All right, next we're going to talk about the cumulative stress reaction. It's also known as the burnout. And a lot of the times people in EMS, they say anywhere from 7 to 10 years is when they get to that burnout period. If you make it longer than that, you're one lucky person, obviously. But there are people that obviously do go several years beyond that burnout period. It's not technically triggered by a single critical incident, but instead results from sustained or reoccurring low-level stressors. So possibly in more than one's aspect of one's life, possibly develops over a period of many, many years. So the earliest signs are very subtle, and they may present as a vague anxiety, maybe progressing into boredom, feeling emotionally exhausted. But if you are not, or if these problems don't get identified and managed at this point, then the progression will just continue. At that point, then you will develop physical complaints such as headaches, stomach aches, and such issues like that. You might have significant sleep disturbances, possibly loss of emotional control, irritability. You might start withdrawing from others and increasing your depression. So without the appropriate intervention, a person's physical, emotional, and behavioral condition will continue to actually deteriorate with manifestations such as different migraine symptoms, increased smoking or alcohol intake, loss of sexual drive, or poor interpersonal relationships. It could even go as far as deterioration in your work performance and is very limited with your self-control, and then the significant depression will eventually set in. I guess I caught myself a little bit ahead of time, but again, going over that it does progress to the physical complaints, loss of emotional control, irritability, and depression, and it may present as a severe withdrawal or even suicidal thoughts, requiring that long-term psychological intervention. And again, it's okay to ask for help. We want people to ask for help when it starts to bother us, rather than letting it, get to the point of no return. So just be sure that you are asking for help when you need it, and don't wait. So some causes of stress that you may come in contact with would be a multi-casualty incident, or an MCI. It's that single incident in which there's multiple patients, and examples can range from a motor vehicle crash with 2 drivers and a passenger are injured, to as much as a hurricane that causes injuries of hundreds to thousands of people. So that's what's considered that mass casualty incident. The other one that can cause stress are calls with infants or children. So anything involving a child or sudden death, infant death syndrome, the SIDS, these calls are known to be particularly stressful to all healthcare providers. Um, Another one is severe injuries. So expect a stress reaction when you are called to some place that involves a major trauma, a distortion to the human body, like amputations or deformed bones, significant deep wounds, and sometimes even a violent death from either a stabbing, gunshot wound, or potentially even child abuse. The next one is abuse and neglect, which these cases of abuse and neglect occur in all social and economic levels of society. You may be called to treat an infant, a child, an adult, or even the elderly victims. And if you do happen to have this, just remember, it doesn't mean that it's going to be in that stereotypical trailer court like people think it could be. It could be in a multi-million-dollar lake home that you're having these same issues. So don't think that because they don't look like they have a lot of money that this is going to affect them or not affect them. It affects every single aspect and every single walk of life. So just be sure that you know and understand that part of it. And then the last one is death of a coworker. So that bond is formed among members of the public service sector, meaning, it might be a police officer that loses their life, but you as a responder have, know that person or responded on calls with that person. Or it could be a firefighter or another coworker on the EMS. So death of another public service worker actually can be very stressful on you. Even if you don't know that person personally, it still may affect you and it can cause a stress response. Some other signs and symptoms can be eustress, which is a positive form of stress that helps people work under pressure and respond effectively. And then distress is the negative stress that causes immediate and long-term problems with the health and well-being of you and your partners. You can also have irritability, the inability to concentrate, changes in daily activities, anxiety, indecisiveness, guilt, isolation, or even the loss of interest in work. And if it ever gets to any of these points, you really do need to ask for help. That can be at your local EAP program. You might have a counselor or psychologist or somebody within your service or even within your facility that you work with or work for that might be able to offer you these services. The biggest thing that we stress so much nowadays is to not hold it in, to actually get help and get it taken care of right at the root of the cause rather than waiting several years to take care of it. So a few things to think about. If your partner is beginning to show signs and symptoms of stress, what should you do? Another one, what possible risk could there be to your partner, you, or a patient if stress is left unresolved? And lastly, do you have an obligation to act to help your partner? Another part of dealing with stress is your actual lifestyle changes. So develop more healthful and positive dietary habits are going to actually help you. You want to avoid fatty foods and increase your carbohydrate intakes and reduce your compensation of alcohol and caffeine, which do have negative effects on you. It also increases the stress and anxiety and disturbance of different sleep patterns when you do have that. Another one is exercise. So when performed safely and properly, it can actually help burn off stress. We always tell people that if you're stressed out, go to the gym, sweat it out, cry it out, pee it out, and get rid of all of that excess gunk in your body. It also helps you with exercise. It also helps you with the physical aspects of your responsibility by carrying the equipment and not feeling that it's overwhelming and performing the actual physically demanding parts of that emergency procedure. And then devoting time to relaxing. It's something that most people don't get a chance to do, but try different relaxation techniques too. So these techniques, which include deep breathing exercises and meditation, are very, very valuable for stress reducers. So maybe you don't have time to relax when you get home, but if you're on shift and you have a quiet, dark area, shut the door, lock the door if you have that ability, and just take time, even if it's 10 minutes, 15 minutes, to just stop and let your mind relax. Change of shift or location for lighter call volumes is always a good chance, a good thing to do, or maybe finding a different position to do within the company if it's available. You might have different types of calls, or even maybe more family time. Maybe you just need something to get your mind off from everything that has been going on at work. Another part of dealing with stress is those invisible wounds. So it's no secret that when you get into the world of EMS, you are going to see bad things. I'm not going to tell you you're not, because you will. You will see mangled bodies from car accidents. You will see body parts ripped off from people's bodies. You will see children abused. You will see so many bad things that living in a small town, you're more apt to see more people that you know, and could that cause those invisible wounds? So you and your patients can be profoundly affected by the psychological trauma. So some people see a tragic scene involving a death and are relatively unaffected, where others might experience long-term effects. Maybe it's because you knew that person, or you knew that family, or maybe you knew that child, or you maybe were abused as a child and it brought back old memories. There's always ways, though, to help yourself. There's ways to help your patients. There's ways to help your partners. This section will provide a lot of concrete solutions to help in the moments and hours and even days after a traumatic event. But on an average day, or even a bad day, the body takes in different stimulus, different things that stimulate you from the environment and those in it. I mean, it could be even the people. So whether it's a work, family, or recreation, the brain is constantly working to evaluate the input and then to file it properly. But you shouldn't file it until you've cleaned it up, okay? So if you're saying, this is bothering me, I need to clean up my mess in my head, file it away the appropriate way without drugs, alcohol, and caffeine. So file it appropriately and then put it to rest. If you can't, that is when you need to again go and ask for help. So going back with invisible wounds, there is an ESCAP curriculum. So E is for every patient, S is for social support, C is for choice and control, A is for anticipate, P is for plan and organize, and E is every time. So every time you have a situation, you need to clear it. You need to file it in the right spot. Next is the Critical Incident Stress Management, or CISM. It is a comprehensive system that includes education and resources both to prevent stress and to deal with the stress appropriately when it does occur. So the EMS systems and organizations have different systems for dealing with stress prevention, with the critical incident stress and chronic stress, including wellness incentives and professional counseling and peer support. So take that and run with it. So it's different ways to help you deal with stress, and it's there, so utilize it. You don't have a broken leg and never go get it fixed. You go to the doctor, you get it fixed. With stress, you need to go to somebody and get it fixed. It might not be a doctor, it might be your spouse or your significant other or your partner, or maybe it is a medical professional of some sort, but you don't walk on a broken leg without getting it fixed. So don't walk on a broken heart or a broken mind without getting it fixed. Next is critical incident stress debriefing. So it is designed to help responders diffuse after an incident. The debriefing might happen immediately after a call, or it might happen within 24 hours up to 72 hours. So if that's the case, that's when they bring in a team of trained peer counselors and mental health professionals that they meet with the rescuers and healthcare providers involved in these major incidences. We do not like it to go over 72 hours because it's too much time. but it also helps you to be able to connect the puzzle pieces and help responders deal with stress. So maybe you weren't the first on scene and you didn't understand how that first part of the call went, and your frustration was because something that you felt should have been done or wasn't done or didn't get done, or maybe it was and you just didn't know it. You need those puzzle pieces. Your puzzle's not complete until the last piece is put together. And that's really essentially what the critical incident stress debriefing is all about. It is about putting these puzzle pieces back together to understand from start to finish what happened on that call. The next one is understanding reactions to dying and death. So as an EMT, you will undoubtedly be called to patients who are in various stages of terminal illnesses. And understanding what the families and the patients are going through can help you deal with the stress that they feel as well as even your own. So when the patients find out that they are dying, they go through emotional stages that vary in duration and magnitude. And these sometimes overlap and all can affect both parties, including the family, and it can also affect you as the responder. So the first thing that they're going to see is, maybe it's not a terminal illness. Maybe they were completely healthy and one day they woke up, they were doing their daily activities, or maybe they were going to go, garden or do something down at the lake or whatever the deal may be. And all of a sudden they go into cardiac arrest. No medical history, no issues, no nothing, completely healthy. And now all of a sudden their spouse finds them, they're in cardiac arrest. The first thing that's going to happen is the spouse is going to be in denial, or if it's a terminal illness, no, that's not me. Okay, that's not happening to me. So the patient or the family denies what's going on and they put off dealing with it, even though it's inevitable, it's going to happen. And then they get to the point to where they start to get angry or ask the question, why me? So the patient or the family becomes angry at the situation, and the anger is commonly vented upon family members and potentially even EMS personnel. The next one is bargaining, or okay, but first let me. Okay, so first let me say goodbye, or first let me ask a question. So in the mind of the patient, they're bargaining to seem to postpone death, or even if it's for a short time. I want to say goodbye one last time, or I want my kids to see their grandpa and grandma before they leave, or whatever the deal may be. They're trying to bargain and see what they can get out of that. The next stage is depression, or okay, but I haven't. Okay, but I haven't what? So the patient is sad, depressed, and despairing, often mourning things that are not accomplished and dreams that will not come true because of this. So the patient retreats into the world of the patient's own and is unwilling to actually communicate with others. So if you see this point of the reactions, then that's a serious problem. And then at some point, and it might not be right away that same day, it might be weeks, months, even years later, where they actually have the acceptance or the, okay, I'm not afraid anymore. And then the patient may come to accept that they're dying, or the family members will have that acceptance after they've watched you work a cardiac arrest for an hour. And finally they say, hey, listen, you guys have done everything you can. Just he would not want this or she would not want this. So they've come to accept the death, although they don't want it. They're not welcoming it. And often then the patient may come to accept the situation, even sometimes before family members do, or maybe it's one family member that has been there from the time that the cardiac arrest happened until the end. And, maybe a child came 15 minutes ago, 15 minutes before you were going to call it. And at this stage, then the family needs just a little bit more support. And it's fine. But a lot of the times that acceptance stage will come sometimes that same day, but like I said, it could come several months to years later. So just know that that is a possibility as well. The next part is understanding the reactions to death and dying. So recognizing the patient's needs, being tolerant of their angry reactions from the patient or family members, listening empathetically. If you're not a person who's empathetic or doesn't have empathy, EMS is not the right job for you. I'm going to be straight up and honest. If you don't like talking to people in an empathetic way, this career is going to last not very long for you. But do not falsely reassure them. If you know that they're in that a patient is in cardiac arrest, you have to talk through that with the family. You have to say, we are breathing for them right now. We are doing chest compressions right now. There's nothing happening in their body that they're doing on their own. And ask them, do you understand that? And if you tell them, but tell them in a very simplistic, simple way, simple manner, and very clear English. Don't use medical terms when you're talking to families because they don't understand what it is anyways. Half the time, people in the medical field don't even understand what medical terms are. So in the medical world, it is plain English. EMS, plain English. And offer as much comfort as you can realistically do. I mean, that's another part of EMS that they don't tell you, they don't teach you a lot of, is the empathy and being more than just treating the patient, for cardiac arrest. It is now having to deal with the family and being able to talk to them and so forth. In this next section, we're going to talk about scene safety. So scene safety is perhaps the most important concept in your EMT training, and whether the scene is safe is the most important decision you will ever make going on a call. Unless you stay safe, you will not be able to help your patient and you may suffer serious injuries or even death. So in watching the news, it doesn't take long to see that a violent incident on the street or the ravages of drug abuse or the mass incidents of violence that have been placed on EMTs, fire, law enforcement, in a position where they may be called to a chaotic and unpredictable situation. And now, guess what? You're in the front row. You have the front row seat. You better grab your popcorn and be ready to take the ride because this is what you've walked into. This is what you're signing up for. So why violence is on our minds? It is important to look at what kills and injures EMS providers and then review that. So EMS is typically not a dangerous profession, but you always have to be aware of potential dangers and it is always a priority. So you have to determine that scene safety that will be the most important decision you will ever in your life make going into a call, any call, a medical or a trauma. So with any hazardous material incident, the primary rule is to always maintain a safe distance from the source of the hazardous material. They also have placards. So if you look on any trucks or any farm equipment or rail cars or whatever else, they have placards on there. So you want to ensure that your emergency vehicle that you are in is equipped with binoculars and correspond with the coded colors and identification numbers that are listed in that emergency response guidebook, which again should be in your vehicle that you're driving. So what is your role as an EMT? One, recognizing those potential problems, taking action for personal safety and the safety of others, and then notify a trained hazardous material response team. A lot of the times in this area, what you're going to do is contact the dispatch center, and then they will contact the hazardous material team. But do not treat patients until after they have undergone decontamination. So you do not want a contaminated patient in the back of your truck, and they definitely don't want them in the back of a helicopter because once it's contaminated, you cannot transport another patient until it has been decontaminated. So just keep that in mind that you, as much as they are in pain and suffering and having medical emergencies and so forth, in a hazardous material incident, you do not treat those patients until they have undergone a decontamination process. So the reason for binoculars is to identify hazardous materials before even approaching the emergency site, because some situations can actually cause you to have respiratory distress and if not failure. So that is why you want to survey the scene from a distance. You also may be called to respond to a terrorist incident. So this incident may be small or it could be in a large scale and may include chemical agents, biological agents, radiation, weapons, or even explosive devices. So although these topics are covered in other areas of this text, you want to also make sure that you're looking at the EMS response to terrorism chapter. It is really important to consider this type of incident and what the effect would be on your personal safety. And you can find that again in like the scene safety section or that chapter. So always always make sure that you are keeping yourself safe. I can't stress that enough. So as far as rescue operations go, that is included in rescuing and detangling victims from fires, auto collisions, explosions, electrocutions, and many more. However, it's a difference between rural services and metro services. So for us in a rural service, you are actually probably only working EMS. So you're maybe not trained in extricating people out of an automobile. Or maybe you're trained, but you might not have the right tools to be able to do that. As with hazardous materials, it is important to evaluate each situation and ensure that the appropriate assistance is requested very early on in the call. So some rural services will actually only dispatch their fire department after EMS has requested, whereas other departments, once an EMS is dispatched, the fire department hears that the EMS is going on a motor vehicle crash, and they will automatically come on that crash with them. However, that is not the case. So always make sure that you know what the protocol is for your local service that you'll be working for, and what their fire departments can and can't do and will or won't do. So depending on the emergency, you might need the help of police, fire, possibly the power company, or any other specialized personnel like the hazmat team and so forth. So never perform acts that you're not properly trained to do. If you do, you're going outside of your scope of practice. And we'll talk about scope of practice later on as well. So at the time, what can you do? If you're not trained in hazardous material, or you don't have the equipment to deal with hazardous material, you want to do your best to secure that scene, and then stand by for the specialist to get there, and then they'll tell you what to do. But as you work in a rescue operation or work on patients during that operation, you will need personal protective equipment that includes the turnout gear, which is the coats, the pants, and the boots. It also includes the protective eyewear, the helmet, and puncture-proof gloves. Well, if you're not working for a fire department or working on a fire department, how many EMS agencies actually have that equipment? Very, very few. So that is why, again, if you don't have the equipment to take care of the situation at hand, don't go into it. You have to wait. Again, that's going to be one of the other hard parts about being in EMT or in EMR too, is that you can't do sometimes all of the stuff that is required. Then next, you're going to just talk about the realities. So what is the reality of this? If it's very important to know, and it's likely how to protect yourself from diseases and dangers and different things that you might encounter on an emergency scene. So things seem very straightforward and almost clear cut, but they're really not. So in some situations, you actually have to make calculated decisions between helping or your personal safety. And remember, at the end of every single day, what is your end goal? Your end goal should be, I am going home to my family at the end of my shift. And that's where you have to make some really tough decisions. Is it going to be helping the people that are in a situation, or is it going to be your personal safety? Know that despite your best efforts, some patients are just going to die. It's just reality. It will happen. No matter how much you think, no matter how much you try to save a person, some people just die. I try not to sound as cold as that, but I want you to just know that there's just some things you just can't fix. So scene safety and well-being are determined by the decisions that you make under pressure. Don't become stuck because of pressure. Don't hurt yourself, or don't go home at the end of your shift because of pressure that you're not comfortable with. If you're not comfortable going into a hazardous material situation without appropriate PPE, then don't do it. Get the right people dispatched out early enough on the call so that they can go in there and bring the patients to you, keeping yourself and your partners safe. The next one we'll talk about is violence. So there's 3 words to sum up the actions required to respond to dangers. You want to plan, you want to observe, and you want to react. So first side of things is wearing safety clothing. So non-slip shoes, practical clothing, that's going to help you. Prepare your equipment so it's not cumbersome. You want to make sure that when you're carrying stuff that you know what's in your emergency kits. If it's too heavy or bulky, take your time and figure out who can carry what, because sometimes that will actually slow you down. If for whatever reason you're observing the scene as you approach and retreating becomes necessary, you don't want your equipment to be so cumbersome that you slip and fall, and now the equipment's down, and now that pulls you down, and so forth. Always, and I cannot stress this enough, always, always, always carry a portable radio with you whenever possible, because if you do need help, that is your way to call for help right now. Especially if you get separated from your vehicle. And then decide on the safety roles. So if there will be more than one EMT in the call, tasks should be split up. So maybe it's one person's taking vital signs while the other's preparing the stretcher. One role that is frequently underused is that of the observer. And I know in bigger cities they have supervisors that will go out on the calls with the crews, and they will observe the scene and watch what's going on. However, in rural systems, you don't always have enough people to do that. But never, ever, ever turn your back to a door or not know what is behind a closed door, or if you walk into a home and it's really dark in there, turn the lights on. So figure out who's going to do what and who's going to be that the advisor, so to say, I guess, if that's what you want to call it. But that observer should not necessarily be directly involved with the patient care, but will be actively observing other things such as other people in the area, if there's possible weapons, if there's any mechanisms of injury that could happen. Maybe they're looking for medications or any other important information. So they're not directly involved with patient care, but again, like I said, in rural services, you just sometimes don't have that option. And observing. Observing, I can't stress how much observing a scene prior to you approaching or upon your approach is important. And do not announce your arrival. Turn off the lights and sirens if you become involved in a situation where there is violence. Just be very careful and cognizant of what's going on around you. So you also need to observe. A lot of doing your scene stuff is observing. So you're going to observe for any violence. So any indications that there might be violence, or if you pull up to a house and you hear screaming and yelling or threats being made, you want to stand back until law enforcement gets on scene. If you happen to come across a crime scene, or maybe you're called to a medical, but you get there and you realize, hey, this is more than a medical. This is actually a crime scene or potentially a crime scene. You want to try not to disturb the crime scene, especially if you're not positive. So try to do whatever you can to preserve that scene. Alcohol or drug use. So when people are under the influence of drugs and alcohol, their behaviors could be very unpredictable, and you could be mistaken as law enforcement. So when you go up there, introduce yourself as, hi, I'm so-and-so from EMS. Also be prepared that there could be weapons. If there's, people around and whatever else, weapons that are in view, you can see them. It's the weapons that aren't in view that you have to worry about. If you have people that are acting suspicious, keep an eye on those people. Keep an eye on everybody around, because if there's one person that has a weapon in a home, more than likely there's going to be multiple. Another one is family members. Many people gather at the scene of a collision, and sometimes you'll find bystanders or groups of bystanders beginning to show aggressive behaviors. Maybe it's because you're not working fast enough, or you're not doing something as fast as they would want you to have or be doing it. If this happens, you need to call for law enforcement. So even if you're there to take care of their loved ones, the violence might be actually directed at you. So just be prepared that you have to maybe change what you're doing in a drop of a dime. Another one is bystanders. Bystanders, especially if they're intoxicated or on drugs or alcohol of any sort, they know how to run that scene. Just ask them, they'll tell you, right? But sometimes you'll find that a group of bystanders are actually showing aggressive behavior. And in some settings, it might be necessary to put the patient in the ambulance and leave that scene rather than waiting for the police. You might you might call the police and say, hey, we have issues over here, but they might not be there in time. Those bystanders are getting in your way, they're pushing, they're shoving, and you potentially have a safety issue on your hand. That is when I would say get that patient in the back of the ambulance and get away from the scene. Even if you drive 3 or 4 blocks down to get them stabilized, or if you're especially out in the country more so, but if you have to drive a mile from the scene to stabilize that patient before continuing transport, then do that. Let law enforcement know where you're going and why you left the scene before they arrived. Another one is perpetrators. A perpetrator of a crime may still be at the scene. They might be in sight, but worse, they could be hiding. So especially at night and in the dark, even though you might be told by law enforcement, hey, stage a mile away from the scene, or stage here, or stage there should be a law enforcement officer there with you. And if they're not, request that one be near you, because a perpetrator could actually be hiding in the woods, and they're probably going to see you long before you see them. So now you're sitting in an ambulance in a dark, back area, dark dirt road out in the country, and this perpetrator knows that you guys are coming, and all of a sudden, what happens when they walk up to the side of the window with a gun and say, hey, you looking for me? What are you going to do? Who's going to be there to protect you? So always be prepared. Always have your mind in one area, and that is taking care of what's going on. If you do come to a crime scene, or and police have not actually secured it yet, don't go in there. Okay? Do not go in there. And then the other thing is pets. Although most animals are not dangerous in typical situations or ordinary circumstances, the presence of an animal at an emergency scene does potentially pose a threat. So for me, for instance, I have a German Shepherd. If somebody comes into my home without being invited in, and we don't give them the proper time to get to know our puppy or our dog, he's not going to do well with those people. He's there to protect me, to protect my family, and he may go to the next level. He might bite them. So always keep in mind that you or your pet, or the pets of the patient, could potentially harm you unintentionally, essentially, or not that they've been provoked to hurt you, but that's just maybe what could happen. So when you go in there, give them time. Give these animals time to sniff you, or to whatever. Now, however, if you go to a farm, you have a person who has been ran over by a bull in a pasture. Are you going to go into that pasture? Do you know how to take care of that bull? Do you know how to calm them down? So that is some stuff that you have to be very careful about, is don't go into a place that you're not comfortable. As a safety precaution, do not stand directly in front of a door when knocking or ringing at the bell. You always want to stand to one side or the other. You never know what's behind that door. And I hate to try to freak you guys out, but it is reality. It's truly reality. All right, next we're going to talk about reacting to danger. So observation has provided the critical information needed about the danger. The next step involves knowing how to react. So you have the 3 R's of responding to danger, which are respond, radio, and reevaluate. You do not re-enter a scene until it has been secured by law enforcement. Okay, so what you're going to do is flee. Get as far away from there as you possibly can. Get rid of any cumbersome equipment. If you have equipment on your back and you can't run and somebody's chasing you or somebody's shooting at you, get rid of the equipment. That can be replaced. You cannot be. And take cover and conceal yourself. Always take care of yourself first, your partner next, and others after that. You never want to enter a scene that is potentially violent until the police have secured it and told you it is safe to do so. Even if your partner is pushing you, if you're not comfortable going into that scene, you need to tell them no. If they want to go into it, that's their choice, but you do have that right to get out of that ambulance and not go in. We did sort of brief on this a little bit. So anytime you react to danger, you want to flee, get out of that area, drop your equipment, and can take cover and conceal yourself immediately if a situation does happen to arise. When concealing yourself, That is when you're going to be placing your body behind an object that can hide you from view. So if you look here, they do have a lot of equipment still in their hands. If they would not have that equipment, would they be as noticeable? So that's again why you want to get rid of your equipment if at all possible. Let's go through the chapter review. Your well-being is an important concept. This chapter has provided several ways for you to protect and maintain it. You should never take safety or standard precautions lightly. Each yields an important decision you will make at least once at each scene you respond to, always. Protect yourself from violence and scene hazards at all costs. Protect yourself from disease. Do not be paranoid about catching a disease, but take appropriate precautions. Resilience means toughness or the ability to recover quickly from a difficult situation. It is important for all EMTs to remain physically and mentally strong. Stress may be an immediate reaction from a particular call or cumulative from a combination of life and EMS. Both kinds are bad for you. Seek help if you need it. You will see death and the reaction to death. Each is very personal to those involved. The stages of death are denial, anger, bargaining, depression, and acceptance. Treat people who are under stress fairly and compassionately, even if it is difficult to do so. Scenes are dynamic and can change in an instant. Assessment of scene safety is an ongoing process. Don't be so focused on a patient that you lose your perception of what is happening around you. When this happens, you will have and potentially be injured. Here are some questions to consider. First one, what precautions must I take if I'm dealing with a patient who has an open wound? Number 2, what can I do to help deal with stress? And number 3, a patient who refuses to believe she has a terminal disease and is in what stage of dealing with it? For critical thinking, you are called to an unknown emergency at a tavern. As you approach the scene, you see a man laying supine in the parking lot, apparently bleeding profusely. 2 other men are scuffling, and one seems to have a gun. What actions must you take?